Have you ever wondered how the opioid crisis quietly grips neighborhoods across America? It's not just about news headlines. It's families, local businesses, and entire communities feeling the strain. In some towns, addiction has replaced hope, influencing everything from job opportunities to public health resources. Exploring how this epidemic persists can spark real change. Ready to learn more about its unseen impact? Across the nation, countless individuals were prescribed opioids for pain relief, never expecting a path toward dependency. Doctors once hoped these medications offered quick and easy solutions, yet unforeseen consequences quickly followed. Comfort turned into crisis, catching patients off guard. Have you witnessed firsthand the slippery slope? The fallout extends beyond doctors' offices, impacting ordinary people who never anticipated such devastation in their daily lives. Communities pay a steep price in more ways than one. Local economies are strained by lost productivity and increased healthcare demands, while families struggle silently beneath financial burdens. Addiction counseling and medical interventions demand extensive resources, often outpacing local budgets. Do you see that ripple effect near you? Each personal story resonates within the larger struggle, reminding everyone that one person's addiction can shape an entire neighborhood's future. Law enforcement faces significant challenges, aiming to curb illegal distribution networks while supporting individuals who need treatment, not jail time. Overcrowded prisons aren't solving the core issues fueling addiction. Instead, we see calls for comprehensive strategies that combine prevention and recovery. Is your community finding answers or hitting walls? The complexity of this crisis demands creative approaches that bring law enforcement and public health experts together for meaningful impact. Overdose deaths continue climbing, tearing families apart in heartbreaking ways. Narcan and other life-saving solutions are more accessible, but these tools only scratch the surface. The real challenge lies in preventing fresh cases of addiction and delivering consistent support to those at risk. Have you encountered someone needing immediate help? Early intervention remains critical, hoping to break cycles before the crisis escalates into a tragic statistic touching countless American homes. Pharmaceutical companies initially marketed opioids as relatively safe, fueling widespread prescribing trends. With profits soaring, the darker side remained overlooked. Lawsuits have since spotlighted corporate accountability, but for many affected communities, it feels too little, too late. Are you following these high-profile legal battles? They highlight the tangled web of responsibility in a crisis that ballooned over decades, leaving entire regions possessed by a substance once pitched as harmless relief. Rural towns in states like West Virginia and Kentucky have arguably felt the worst toll, with limited treatment options and insufficient public infrastructure. When jobs vanish and economic despair takes hold, opioids often sneak in as an escape. Does that ring true in your hometown? This crisis doesn't discriminate, but scarce resources compound the issue. Communities once defined by tight-knit bonds now face heartbreak and uncertainty across generations. Treatment programs vary widely, from medication-assisted therapies to faith-based support groups. Yet many remain out of reach for people who can't afford consistent care or live miles away from facilities. Does a one-size-fits-all solution exist here? Probably not. Personalized plans and long-term follow-up seem essential, helping individuals rebuild lives. Investing in varied, accessible resources is the challenge. Expanding these offerings is urgently needed to mend the fractured fabric entire communities share. Education stands as a critical line of defense, guiding people towards safer choices. Teaching students early about the risks of opioid misuse can create awareness before temptations arise. Do you think interactive education can shift behavior? Many prevention programs incorporate real-life stories that resonate deeply. However, schools often juggle tight funding, limiting their ability to introduce comprehensive anti-drug curricula. The question remains, who will bridge these essential gaps in knowledge? Families often take on the caregiving role, supporting loved ones affected by addiction. Parents, siblings, or spouses might face emotional strain and social stigma while they desperately seek guidance. Has someone in your circle endured that complexity? Coping strategies include therapy, community groups, and honest dialogue about mental health. Open conversations help dismantle shame, reminding people that seeking help isn't a sign of weakness. It's one step toward lasting recovery. Some grassroots organizations have emerged, offering harm reduction services and awareness campaigns to counter opioid misuse. Have you seen local volunteers distributing overdose prevention kits or hosting educational sessions? These community-led efforts tackle stigma head-on, reminding everyone that effective change doesn't always require massive budgets. By encouraging neighbors to watch out for each other, small programs can spark meaningful dialogue. Ultimately, neighbors helping neighbors can make an enormous difference in struggling areas. Recovery often involves complex, lifelong management where setbacks are a reality. People might relive trauma or struggle to access stable housing, factors that can lead them back to substances. Does your community provide safe housing or job placement assistance? Real success stories prove that compassionate re-entry programs and supportive environments reduce relapse rates. Reintegration shouldn't be an uphill battle. Collective efforts pave the path for genuine transformation, one step at a time. Despite its overwhelming challenges, the opioid crisis has also sparked innovations in telemedicine, mobile clinics, and peer support networks. Have you encountered these new formats? They aim to dismantle barriers like transportation and stigma. By making resources accessible through technology, more individuals can start or continue recovery on their terms. However, consistent funding is vital for these tools to reach remote communities. Could this point toward a compassionate, tech-enabled future? With so many lives impacted, what role can you play in addressing this crisis right where you live? Each conversation, each connection, and each moment of empathy builds progress. If you found insight or inspiration here, why not share these ideas with friends and family? Every view and discussion brings us closer to possible solutions. Remember to like, share, and subscribe to our channel for more meaningful content that matters now.